No, because we don't have the passion to become medical professions. Ya Jama'ah, follow your passion. Do something that you love in this life. This way you will enjoy it and will be most productive in it. The طب is not your cup of tea. Look up what is your cup of tea. Look up what makes you enjoying it. Part of the business is when we provide you with some information, we have this interaction, أنا بسميه the show, okay? And then you go home and you go through the slides and you watch some videos and you see, remember what I've sort of talked about, and then you look it up and you enjoy it and you immerse yourself into the slides, and this is how you memorize and understand. Understand first and then memorize. So you don't have to memorize. If you immerse yourself and enjoy it, there is no need to memorize. And أصلا الأسئلة MCQ. So we're going to tell you what is the right answer. You just have to choose it. صح؟ فهمتوا شو حكيت؟ طيب. So next week we'll talk about aseptic meningitis syndrome. So I'd expect you to answer my question when I ask you next week. طيب? So we talked about that, and then we talked about the acuity and the epidemiology and the concept of epidemiology, the importance of epidemiology for all diseases. We showed you the meningitis belt in Africa. We talked about the microbiology, the different microbial agents that causes the infection and the variation between them, the age, the predisposing factors, people at risk for what. And then we talked about the value of certain vaccines that are now available and how they help us fight some of them. And then now how we see the gram-negative bacilli filling the void, filling the gap that we created with modern medicine and vaccines. And now you're looking at new types of infection that causes the meningitis. Okay? Malphilus, Neisseria, strep pneumonia, listeria, group B, and the gram-negative Coccobacilli staph, aureus and epidermidis with the CSF shunt. And then we stopped here and we said we will discuss how a bug will colonize the nasopharynx. If it's successfully colonizing it, first of all, it needs to attach, adhere, colonize, and then disseminates. And if it disseminates successfully enough to reach the level what we call bacteria in the blood, okay? Bacteremia, that's normally bad news with high fever. وانت بتحكي لزوجتك it's okay, we don't want to take them to the hospital. Let's wait it out. It's a flu, and it's not a flu. Okay? It's a sustained bacteremia. They need antibiotic. Okay? At some point, the bugs will cross the blood-brain barrier through 4 different mechanisms that we will outline today and start interacting with the limited power of the CSF immune responses. That normally leads to 3 things. The outcome of this is increasing the permeability of the blood-brain barrier, so more recruits, more soldiers will go through, increasing the intracranial pressure, hence the headache, مش في headache بالsign and symptom of meningitis, and edema. 3 types of edema that we will discuss. All these 3 together, they will form something called permanent neurological damage. That's the natural history of bacterial meningitis that normally leads to permanent neurological deficit. تمام؟ لأنه nerve cells, do they replicate or they don't? They don't. That leads to permanent neurological deficit that leads to that or a lot of complications all the way to death. يعني. So this is the story. Now, if we were to zoom in into the 2 big players that I mentioned yesterday, strep pneumonia and Neisseria meningitidis, that they are the most common cause of acute bacterial infection in age between 2 and 50. Check. The adult age, in which the immune responses are more healthy, more robust. Not strong, more healthy and robust. Meaning what? Balanced immune responses. إحنا بالimmunity, we're looking for a balanced immune response. Just enough to clear the bug and not cause permanent or unwanted damage to the host. مش هيك؟ تمام. So as you can see here, the opsonization, the phagocytosis, the complement-mediated membrane attack complexes that leads to killing and clearing the infection. Now the bug, strep pneumonia and Neisseria meningitidis, deploy many of its virulent properties, وعلى رأسهم the polysaccharide capsule, to evade these immune mechanisms. Along other lists, I've listed it out here, surf antigens and toxins in both, that leads to successful crossing this, which is the blood-brain barrier. Through the cell is one mechanism, crossing through the cell. Between the cells is another. And, Shuraiku, what else? There are two more mechanisms for crossing the blood-brain barrier. Through the cell is one. Between the cell is another. What else? Yes, sir. Yes, Trojan horse mechanism. Do you have a Trojan horse? You've seen the movie? It goes into the macrophage, and the macrophage circulates normally crossing, and then it's in. وآخر route اللي هو non-hematogenous route اللي هو through the routes of the شو في بالمخ غير الدم؟ cranial nerves. ما في lymphatics. في lymphatics? Cranial nerves. Yeah? So that's the fourth mechanism of crossing the blood-brain barrier. Okay? Throughout this process, it's really important for you to grasp and understand and have that depth of knowledge for the molecular mechanism of how this is established and what are the things that affect what? Mucosal colonization, intracranial survival, meningeal invasion, and survival in the subarachnoid space. Okay? These are the things that the bugs deployed to establish this in the process of pathogenesis. Okay? And these are the list of things that the host deploys. So let us entertain one. Survival in the subarachnoid space. And after it crossing the blood-brain barrier, the first thing اللي فرجتكم إياه بالalgorithm كان survival in the subarachnoid space. The capsule is one of the factors that are important for a lot of things, but primarily for surviving in the subarachnoid space. And the host factors, such as poor opsonization effect. ليش؟ لأنه the CSF, okay, blood is your most robust immune responses. موجودة في البلد، صح؟ We agree? طيب. وبعدين the highly sophisticated blood-brain barrier that I'll show you an image in a minute is your last fortress of a highly fortified defenses to prevent a bug from crossing. تمام? When it comes to the CSF, the immune responses are inadequate. They're not enough. They are nothing compared to the immune responses in the blood. وهذا for a reason. تعرفوا شو الreason? Protecting your brain from an inflammation. تخيلوا إنه the blood inflamed for any reason, مش هيك? And we deal with it. But we cannot afford to have a strong inflammation inside the central nervous system, because then you will have a lot of nerve damage that are irreversible, مش هيك؟ صح؟ فالthe CSF immune responses, وين السلايد؟ ما وصلناش لعند السلايد, بس we will get there in a minute. The CSF immune responses are normally inadequate, enabling the subarachnoid establishment of infection, leading زي ما حكينا increase in the cranial pressure, headache, cerebral edema, photosensitivity, papilledema, and establishing the infection, the third mechanism. طيب. So Fembiria is one. We've talked about Fembiria before, and we said it's important for attachment. So that's one. IG, I'm just giving you examples. IgA, circulating IgA normally are there to clear the infection. But Neisseria, for example, deploy the mechanism to attach to the IgA and IgG and deactivates it. Okay? So that's one of the host immune evasion processes. And the capsule, as we've mentioned before, capsule, it requires, راح أسألكم عنه بالامتحان, the classical complement mediated mechanism, right? So the capsule evades the classical. So if it's a capsulated bug, we're trying to clear it, activating the complement, the classical cannot get rid of it because it evades it, but the body activates what? The alternative complement mediated C3. That's the one that is capable of taking care of a capsulated microorganism. That's an exam question, okay? You get it? واضح؟ واضح ولا مش واضح؟ بالله عليك واضح؟ طيب. Blood-brain barrier, طبعا natural يعني function, regulation and protection for the meninges, yeah? And as I said, the four routes in which the bug get in, through the cell, between the cells, non-hematogens, bacterial nerves, and the Trojan horse leukocyte facilitated mechanism أو زي ما سمينا هون Trojan horse mechanism. هلا one question. In the algorithm I showed you bacteremia صح؟ حكينا وش nasopharyngeal colonization مش هيك؟ If it's successful ما بعرف شو دا invasion leads to bacteremia, bacteria in the blood. طيب, how much of a bacteremia and how much bugs do we need to successfully establish a crossing to the blood-brain barrier? We don't know. That's a black box. We don't know. But studies have shown, studies on mice, on higher primate, showed إنه sustained bacteremia for more than 6 hours. مدام بتقول لك وديه على الدكتور وانت بتقول لا it's a flu. And the child is toxic looking, high fever, not eating, okay? ولما تعطيه الفيفر medicine, the fever doesn't go as fast and it doesn't stay low that much. هدول يعني things to think about when you try to weed out whether this is a flu, a viral infection. There is nothing we need to do. We just give them fluid and vitamin C and rest. Versus someone with a suspected bacterial infection that they need to go get a blood tested. We look into the C-reactive protein. If we see a lot of neutrophil, a differential white blood cell, neutrophil, that means what? Bacterial infection, مش هيك? And thereby we take a sample for testing susceptibility وgrowth واللي بدكم إياه, and then we give what? Prophylactic antibiotic, okay? For a toxic looking child with high fever that doesn't go down, when you give the anti-fever medicine, it goes down a little bit and it goes up again rather rapidly, or very toxic looking, take them to the doctor. The first thing we do, a very quick blood test for the C-reactive protein and white blood cell differential. خلال نص ساعة إلى 1 hour, we know a high index of suspicion, a good guess, إنه you might be dealing with a bacterial infection or a viral infection. And thereby the doctor in the emergency will like, okay, let us give them prophylactic antibiotic to prevent the sustained bacteremia which normally leads to successful crossing and establishing meningitis. Okay? That's how we deal with it. Please remember what I'm saying لأنه هذا مهم الحكي. مهم for your practice يعني مش مهم للامتحان. مهم for your practice. مهم to understand what I'm saying. دائما العقدة. Is it a viral infection? Is it a bacterial infection? Do I give antibiotic or I don't give antibiotic? Okay? إذا الدار كلها flu وراني nose ومبين flu خلاص it's a flu. The child is active. He's running. He's playing. He's eating. Okay? But when he's toxic looking, no one else is sick, very high fever, and it doesn't go down, it's worth a visit to the ER and doing a blood differential and C-reactive protein. That really gives you a very good indication whether or not most likely have a bacterial or a viral infection. بنعمل susceptibility والblood growth وهذا بعدين, بس at least we give them prophylactic antibiotic preventing the further complication اللي هو ايش؟ meningitis. واضح الحكي؟ So high grade sustained bacteremia. ليش؟ لأنه عدد البكتيريا بيزيد بالدم. For the number of those who will cross is even more. Then your meningitis even a worse meningitis. تمام؟ Inadequate suboptimal CSF immune responses. Now you know why. صح؟ It's thing that we to protect the nerve from or the nerve cells from the damage that could be caused by the immune responses. مش هيك؟ But that's why we have the blood-brain barrier as the last fortress protection from invaders from the outside. And then we talked about the different types of cerebral edema, the vaginogenic, cytotoxic, and the interstitial. راح أسألكم عنه بالامتحان. وكمان subarachnoid inflammation leading to neuronal damage. And that damage is permanent. صح؟ طيب, good. So what are the symptoms and signs of?
How severe? The average. If we average it out, the average bacteria. How severe is the irreversible?
هلا بنحكي عليه بالسلايد. At the end, I'll show you. It ranges from hair loss to seizure and permanent neurological deficit to as someone with a stroke. Literally. هلا I'll show you. So شو ال signs and symptoms? حكينا headache, fever, change in mental status, مش هيك؟ Pertain the pathogenesis. Now you understand where the headache is coming from. Now you understand where the altered sensorium and altered mental status is coming from. صح؟ كيف بنسأل على altered mental status للبيشنت؟ شو بنحكي له؟ نقول له is your mental status is altered؟ بقول لك This is how we ask for altered mental status. صح؟ شو بنسأله؟ What's your name? What's the time? Check. Is it day or night? Where are you? وين أنت؟ المستشفى أنت وين؟ صح؟ So this is how we assess mental status. Or you can just ask them. لا, you don't ask them. طيب, headache, fever, meningitis. طبعا, as you can see, in a less than 2-year-old, they will not come to you and say, oh, I have headache. والله يا بابا. صح? Give me a cigarette. That's not going to be the case. They will be crying incoherently. Okay? Although they're not hungry, although they did not wet themselves, they're just crying. Okay? There's a bulge anterior fentanyl. So for anyone less than 2, we assess their feeding, their activity, and their passing stool and urine. These are the 3 things that we normally assess for anyone less than 2-year-old. Okay? If they're feeding well, they're active, playful, and passing stool and urine, that should be in good shape. Otherwise, crying, bulging anterior fentanyl. متى بتسكر anterior fentanyl? والposterior before that, yeah? And why do we have anterior and posterior and the fissures? عشان شو? To pass through the birth canal. طيب, ممتاز. So these are the signs and symptoms. طبعا it varies as you go older, and the tirade in adults, and that's the story. مش هيك? All the way to what? To the least frequent one, اللي هي less than 5%. شو هي؟ papilledema. لما اشوف papilledema شو يعني؟ يعني herniation. يعني the intracranial pressure have risen so much, you're looking into cerebral herniation. That's how bad. واضح؟ عافانا الله وإياكم. قولوا آمين. خايفين حالكم ها؟ طيب. Brudzinski and the Kerning sign. These are signs that you will take inshallah in your clinical years, and simply it elicits what? The meningeal inflammation. You read through it for your fun. I will not be asking you about it, but it's good to know this from now and how it's performed. And you can perform that on your colleagues or your little brother or sister or your mom إذا حابين تنكتلوا. طيب. Pathogen specific findings. We have Neisseria meningitis with this rather characteristic pathognomonic rash. Okay? Now for Listeria, we have seizure. Normally, if the question is presenting someone with a seizure and unpasteurized cheese eating in a travel to France or eating coleslaw, possible contamination, others have the same manifestation, and this person was vaccinated with Haemophilus and strep pneumonia and Neisseria meningitis, then most likely this is Listeria, okay? But the erythematous macules, that they coalesce at some point and become purpuric form like this, that's characteristic of Neisseria meningitis. Is it early or late? Late, very severe. CSF. زي ما حكينا, CSF, the one thing that I really need you to know is the difference between CSF analysis between a viral infection and a bacterial infection. What would be the difference? Neutrophils dictates bacteria ولا? Bacteria. Monocytes or lymphocytes are virus type. Glucose and protein. Glucose is higher or lower بالبكتيريا? Lower بالبكتيريا. ليش؟ لأنه البكتيريا, the theory, it's not أكيد, consume the glucose. That's lower. Whereas the proteins in bacteria are higher, up to 500 زي ما مكتوب بالسلايد. And the other parameters, including the opening pressure. That's nice and dandy على قولة ال southern people, بس المشكلة وين? When do you tap? When do you tap? Who should have a lumbar puncture? Here يا جماعة ندخل في إشي اسمه the risks outweighs the benefits and vice versa. واضح؟ What are the risks of this rather risky procedure? Spinal tap, injury to the nervous system, introduction of infection, bleeding, handling, shake. So there's a lot of risk involved in a CSF tap, especially if it's a trainee, مش medical students, or medical students, and then if they're not supervised properly. Okay, من وين التاب بصير L3-4 ولا L4-5? So look up إذا أنتم حابين هيك تستمتعوا to enjoy yourself. Look up CSF tab and how it's done and what are the precautions, what are the risks to the patient, and what are the medical legal issues and malpractice risks that you are running as a clinician, assuming we have medical legal lawsuits in this country. Okay. Now here is the algorithm that we normally follow. وهذا يا جماعة it varies from one country to another. Okay. Where is the practice? بشكل عام blood culture. شايفين blood culture؟ دائما في blood culture. طيب do you do only blood culture ولا you do also CSF tab and also you culture the CSF؟ لأن CSF culture is the gold standard. It is. يعني what's better than identifying a microbe growing in the CSF than culturing the CSF مش هيك؟ بس دائما we outweigh the risk and the benefits, and this is one of the algorithm taken up from Mandel, a book that was published in the US of A. Now here, I don't know what the practice is, but I know, and my point here is to raise your awareness of whether or not we should tab and the risks and the benefits of CSF tab. واضح? واضح? That's the story here. Diagnosis, as I said, CSF gold standard culturing is and continues to be, but with the advancement of medicine, we are moving from traditional microscopy and traditional microbiology, testing susceptibility, growth to culture, gram stain into polymerase chain reaction, MALDI-TOF, molecular identification and susceptibility techniques. تمام? So anywhere you see a PCR in the answer key, بشكل عام PCR is the right answer. Unless I'm saying what's the gold standard, بتجاوبوا CSF, culture of the CSF. ماشي? So culture, chocolate agar plate or blood agar plate, whether or not the three big players grow and what do they look like on gram stain. Gram stain stains what يا جماعة? Gram stain stains the peptidoglycan layer. Check. The thicker the peptidoglycan layer, the more gram stain will be. Check. And thereby it will be positive. The thinner the peptidoglycan layer, the less stain will be in that layer. بالشيك بنسميها جرام نيجاتيف. صح؟ مثل الحنة. تعرفوا الحنة؟ لا. طيب إن شاء الله بس تتجوزوا بتعرفوا الحنة. Management. As you can see, there are variations. مش هيك بحبش التسجيل. Variations, okay, in the antibiotic that we give. لأنه ما مش معقول يعني it's not really coherent to give the same antibiotic for elderly and children, and it varies accordingly because of the side effects and the other considerations, including people who are immune compromised and susceptible. Okay? بالعادة أنا ما بسألش على antibiotic treatment. Normally I don't ask, but this is for your knowledge and hopefully for the clinical years in which you get to know it. What's important, however, and it was debatable in the field, should you or should you not give corticosteroids before the administration of antibiotics? I've already answered this question, but I'm going to ask it again. Why do we give corticosteroids to someone with a bacterial infection? والcorticosteroid شو بيعمل؟ بيقلل من inflammation. طب ما احنا بدنا inflammation to kill the bacteria. In this case, we are less worried about killing the bacteria and more worried about protecting our own CNS tissues from the determinant effects and the poor outcome of the inflammation itself. فهمتوا علي? So that's why حتى CSF it has less immune robustness and responses than the bloodstream, as I explained before. مش هيك؟ فthereby we give CSF concentration of TNF alpha بينزل مع corticosteroids. The leukocytosis بقل مع corticosteroids, and the glucose, lactate, and proteins بيزيدوا when we give corticosteroid. Really calming down the storm. Calming down the storm, preparing the body for the administration of the antibiotic that will kill the bacteria for you. Another point. If you give the antibiotic right away, شو بده يصير بالبكتيريا؟ It will rupture. أحسنت. Produces more toxins and more inflammation and more damage to the CNS tissues, and that's why we like to give corticosteroid before. Important for the exam? Yes. The three things, including what your colleague just said, which I didn't mention to the other ones. I hope they get it on their own. I'll have you recording so you can share. And then here are the recommendations in different parts of the world. And my understanding, we do give adjuvant corticosteroid in this country. Prevention, obviously obvious. We prevent those at risk, مش هيك? Those who are going for pilgrimage with the vaccines. That's prevention. Prophylaxis for close contacts, for healthcare workers, مش هيك؟ أنا وأنتو يعني. Prophylaxis. Household members, close contacts, we normally try to give them something to prevent them from getting the disease, such as a prophylactic antibiotic. Age, etc. Complication, to your question, normally any children with سحايا, بالعربي meningitis, we normally recommend a visit, a consultation with the ENT doctor and testing their hearing loss. That's the most common. The rest is a laundry list of things that we suspect. Okay? All the way to memory and communication and reduction in their mental acuity. يعني almost مثل الCP, مثل cerebral palsy. Okay? They become dull, hardly understand, they're incoherent. عافانا الله وإياكم. Yeah? What are we looking at here? In the blue, this is electron microscopy of Neisseria meningitidis. حبيت أسلم عليكم يعني قبل ما نطلع. This is Neisseria meningitidis in blue, and the yellow are what? Show in yellow. Pili that are used for what? البايلاي attachment, adhesion. شو مالكم؟ والبايلاي كمان. Pili and Fimbria are used for attachment and adhesion. بس شكلهم بيختلف. هذول أكثر هذولاك أطول. Okay? So this is, subhanallah, fascinating electron microscopy of an Neisseria meningitidis and its pili that are used for attachment, adhesion, successful colonization, dissemination, and causing an infection. I hope you enjoyed and benefited from bacterial meningitis. Next week we'll talk about viral meningitis and the other things that causes meningitis. Okay? Questions?